Hello, everyone. Welcome. We'll just give people a couple of minutes to file in, and then we'll get started. Okay. So people are still kind of coming in, but maybe we can just get started slowly. Hello, everyone, and welcome. My name is Kerry James. I'm the Chief Executive of the World Hepatitis Alliance, and we'd like to welcome you today to the launch of this year's World Hepatitis Day campaign. I have two colleagues joining me who will also be presenting, so I'll ask them to introduce themselves. Toby, would you like to go first?
Yeah, sure. Hi, everyone. My name is Toby, and I'm the Marketing and Communication Officer here at WHA.
And Steve.
Hi everyone, I'm Steve. I'm the Marketing and Communications Manager here with the World Hepatitis Alliance.
Brilliant. Okay, so let's go to the next slide, please. Just some housekeeping. So today we're going to introduce you to, oh, we can do this first. So we do have translation available. It's okay. Let's just go to the translation one. That's basically what we're going to be talking about today. Basically, we'll be introducing the campaign, introducing some of the advocacy actions, and giving all of you the chance to ask questions and to interact as well. We do have translation available. Our crack team of translators, Carmen and Sylvia on the Spanish translation, and Benny and Laurent on the French translation. Next slide, please. So if you just look on the bottom of your screen, there's an interpretation button. Just choose the language that you would like to hear, and then you should hear the translation through there. Great. All right. So without any further ado, we can talk about this year's theme. Oh yeah, please, everyone, if you would like to introduce yourselves in the chat, please feel free. We will be using the Q&A function, so if you have any questions along the way, please put them in the Q&A. And if possible, if people put their hands up during the Q&A sessions, we will try to give you the opportunity to speak as well. But as many of you probably know, for the last few years, we've been using Hep Can't Wait as the World Hepatitis Day campaign. And that's been very successful, and people have really engaged with it. It's been a really powerful message. And while Hep Can't Wait will continue as a campaign outside of World Hepatitis Day, this year we thought, and it was the feedback, that it was time to have a new approach, perhaps some fresh, creative, something fresh to talk about. So we have a video to introduce the campaign and the main campaign video for this year. So let's play the video, and then I'll tell you more about it afterwards, because I think it really sums up what we're doing this year. So yeah, Steve, could you please play the video?
Hepatitis is now the world's deadliest virus after COVID-19. It claims 1.3 million lives each year, and the number of deaths is rising. There is no time to waste.
It's time for action.
Leaders, it's time for action.
Politicians, it's time for action.
Doctors, it's time for action.
Communities, it's time for action.
This World Hepatitis Day, 28th of July, we must all take action.
Test,
Treat,
Vaccinate.
Visit worldhepatitisday.org.
I'm not sure how the audio was for everyone else, but it was not great for me. So no, Steve, did you have the full audio come through on yours?
I did have the full audio here, but I can show people where they can see this film on the website as well.
Okay, well, basically, if you only got the voices, there's also a very strong like drum track under the whole thing because it's really meant to be, the video is really meant to be a call to arms. I mean, maybe because it's running through an iframe, we lost part of it. But yeah, please do visit the website and have a listen. And if people feel they would want to use it in another language, we can look at translating the on-screen text so you can have it in your language as well. So please reach out to us, send us a message, put a message in the chat, and then we can look into that. So next slide, please.
Hepatitis is
So it's time for action is the World Hepatitis Day theme for this year. And I think there were two main motivations while we were developing this concept. And one was, just focusing on World Hepatitis Day as an awareness day, as a time to talk about hepatitis and to get tested and to do things, because for the last few campaigns, we've really focused on the campaign itself and not on World Hepatitis Day. So the idea was really to make the most of the day and the opportunity. And secondly, I think many of us will be aware of the data that came out in the Global Hepatitis Report at the World Hepatitis Summit earlier in the year, and just how we're losing momentum or in the fight against hepatitis, and many of the indicators are going the wrong way. Number of deaths is rising. A lot of the other things that we would be hoping we would be seeing progress by this point are not progressing. So it's time to stop talking and it's time for action. And the other motivation around the messaging is really so all of you can use the campaign and tailor it to your own settings and to your own priorities. So the action that needs to be taken can be interpreted by you for your own needs this World Hepatitis Day. Next slide, please. So there's three main buckets of action of call to action. Some very simple ones, which would be take action, get tested. We know that for most people, the two most common activities during World Hepatitis Day is awareness raising and actually doing community testing. So we wanted to make sure that the assets really helped you and supported you in that, getting people to test. But also we know that it's about more than testing. It's also about, getting people to access treatment if they need it, and also vaccination. So you can see the middle one enables people to have a wider conversation about hepatitis beyond just testing. And then the third one is really a call to the general public or people that are seeing these that perhaps aren't tested, that they should find out more about testing and vaccination, whether that be through a healthcare provider or through a community-based organization, or even through the World Hepatitis Day website. Next slide, please. And as always, we've translated the materials into 8 different languages in hard-coded ones, meaning that these are available to download with the languages already in place. But there's also, through the poster tool, ways to translate it into whatever language you want to tailor the messages to exactly the ones that you need. And Steve's going to talk about that in a moment. So next slide, and over to Steve.
Hello, everyone. So yes, I'm going to talk through some of these assets, and I'm going to begin with the website. So I'm actually going to stop sharing this presentation in a moment to give you a tour of the website, but just so you know what you can expect to find on there. We have campaign guidelines, which condenses some of the information from the website. These are downloadable as a PDF. They also have the visual and verbal identity of World Hepatitis Day for you to use. You'll find posters that you can download. We have image-based posters like these. And we also have typographic-based posters like these. And we have our poster tool as well. So this is where I can take you to the website and just show you how this works. Right, so hopefully you can see this on the screen. I'll just take you back to the main World Hepatitis Day page. So you can land here and you'll see that we've got various things, various parts of the website where you can take action, you can make a pledge, which we'll come to, discussion of supporters, and campaign resources, which we'll go to in a second. But here we have an overview of the campaign on the landing page and links to these various different parts of the site as well with a little more information so you know where you can go if you want to pick up particular things, and a summary report of last year as well. So say you want to get hold of some of those posters that I showed you. Go to campaign resources. Under here, you'll find the campaign guidelines that I mentioned, posters, social media assets, which we'll come to shortly, things like logos, the film, Zoom backgrounds that we're modeling today, and the poster tool. So this allows you to create your own posters and social media graphics. We've got the image posters, the text-based posters. We also have image-based graphics for Twitter and Facebook, text-based graphics for Twitter and Facebook, image-based graphics for Instagram, and we do have text as well. That's just not showing, but I can sort that out after this webinar. Just a little glitch there. I'm going to show you how to create your own customized A4 poster. So this is where it starts. As you can see, we've got the poster artwork, and we have the option here to select different images and different messaging. So if I select a different image and a different message, and go down to update poster, you'll see that the image changes, as does the message. We can also translate this. I'm going to choose Albanian because I'm a big fan of their letter types. And then from here, you can actually add your own images, which includes logos as well as photos. So here I'm going to choose an image. There is a note at the top of the page that depending on your internet connection, this may take a little while to upload, but that has done so quite quickly. And here I'm going to add in an image for the logo, which you'll see at the bottom. I'm going to use our Community Impact Program logo here. Now that that's uploaded, I'm going to hit Update Poster. And you'll see that we now have a beautiful poster with a different image and the additional logo next to the World Hepatitis Day logo there as well. There's also the option here to change the text. So if there were different calls to action that you wanted to include here, or if you wanted to translate things in a different way, then you have the option to do so as well. I can show you a little more of that on the event poster tool. Down here, we have the event poster tool, which is designed for any of you that are doing any kinds of actions that you require people to come along in person. It includes information on when and where and who to contact. And again, this is translatable. So I'm going to leave the example text in there at the moment and just show you what things look like in different languages with different kinds of scripts. We also have hard-coded languages for various other assets. So there might be some things like Arabic where if you wanted to translate in here, maybe better to use the original hard-coded versions. But here you can see Sanskrit has not worked. But Polish has. And we also have social media assets that can be updated in much the same way using the poster tool. So here we can select the Instagram with image. And again, we have different options here, different translations. For different purposes. So that's an overview of the poster tool. Just return to our PowerPoint now. And of course, we have the hero film. Apologies if the audio didn't come through very clearly earlier. However, the hero film is on the website under the campaign resources. So you'll be able to watch that after this webinar if you didn't quite hear it earlier. I'm going to pass over to Toby now to talk about some of our social media assets.
Steve, just let you know you stopped sharing.
Oh, I apologize. One moment. So yes, sorry. To reiterate, the hero film is also available on the website. And I'll pass over to Toby, the social media assets.
All right, thank you so much, Steve. Just as Steve has mentioned, we have a range of social media assets that you can download under the campaign resources page, with our key messages and images as well. So you can also translate any of this in your language of your choice. And if you're feeling like adding your own copy or your own images to it as well, like Steve has mentioned, you can always just go under the poster tool and add in your own copy, your logos under the World Hepatitis Day branding. And as we always do every year, we have the social media, the global social media campaign on social media that we just have the hashtags World Hepatitis Day and to reflect the theme, time for action. So please feel free to go on our website and download any of these materials. And they have been created to accommodate the various social media needs. For instance, you can use the square assets on Instagram and the landscape on Twitter, LinkedIn, and on Facebook. Please don't forget to tag us on all of our social media platforms as well whenever you are using any of our assets. Thank you. For the next slide, Steve. Yeah, so we have the gifts as well, just to build up momentum ahead of World Hepatitis Day. You can just always use this gives that from 1 month to go, 5 days to go, 2 days to go, just building momentum and sharing of conversations on social media. And like I've said before, please tag us on social media, on all your social media platforms at World Hepatitis Alliance on Facebook and Instagram, and Hep_Alliance on Twitter. And so that just so we can track the conversations. Yeah, next slide, please. I'll just pause for any questions if you have.
Okay, great. So we just pause here quickly if anyone had any questions about anything you've seen so far, the assets, etc. Richard, I see you've had your hand up. Can you unmute Richard, Steve? So I can't.
Oh,
I'm
just
not a
bear with me
host.
one moment. Fire away, Richard. Sorry about that.
I think you still have to. Oh yeah, Richard, you can unmute and speak, ask your question, or make your comment. Richard, if you're there, you can unmute. Hi, Richard. Richard, you can ask your question or make your comment. Or feel free to use the Q&A section as well if you're having problems with your audio. Maybe, Richard, just while you're doing that, maybe we can go to Tony, who always also has his hand up. Tony, and maybe, Richard, you can put your question in the Q&A. Tony, you can unmute. Tony Garba.
Can you hear me?
Hi, Tony.
Okay, good. Good afternoon here in Nigeria. It's past afternoon, past 12. It's a good launch. The question I want to ask is the resource materials you say you are giving us. Are you saying we should start placing them for sensitization campaign, mobilization on all our social medias and even one-on-one speeches, contact with persons, or we are going to start using them by the end of this month? When are we to start using them?
So
Hello?
the Alliance will... Sorry, yes. Thank you, Tony. Yes, we heard you loud and clear.
Good.
So I think the Alliance will start using, in earnest, the social media assets from the beginning of July. But of course, if you have events and you want to use things earlier, then you're very willing to do so. As soon as after we release it, then you're free to use them as you wish. But as far as the Alliance is going, I think we're starting the main part of the social media campaign a month out, actually. So maybe the 28th of June. Is that right, Steve and Toby?
Okay.
Yeah, we can start rolling things out from when we put out the communications toolkit, which we'll mention a little later as well.
Okay. Then I think it is good that we all start at the same time so that the public may not feel that one is isolated from the main body or this is a different one. Though we have small advantage because we are already engaged in advocacy right now from the CIP, which we had in Lisbon and which we had online. So we have a little advantage now. That's what I was asking. But I think it is good that we all start at once with the whole house globally. and so that one does not cause a kind of confusion or keep some people, is this a different one or a new one? So I think you have answered my question. Thank you.
Okay, that's a good suggestion. So I think our post using the will really start in earnest on the 28th of June, just so we don't, keep some of our powder dry. And we'll launch the film on the 14th of July, I think. So we'll launch the film globally 2 weeks before. Again, just so it doesn't get too old by the time we get to World Hepatitis Day, to keep it fresh in people's minds.
That's right. That's right. Absolutely. It's okay.
Thank
Thank
you.
you very much. Yeah.
Thanks, Tony.
Thank you.
Richard, would you like to try again? Maybe Steve, could you open Partha's microphone, please? Maybe Partha, please go on.
Am I audible? Am I audible?
Yes, I can hear you. Yeah, you may go. Yeah. Hello.
Yeah. Just I'd like to know that I have seen one campaign message that is you have written that viral hepatitis is the deadliest virus after COVID-19 or something like that. So my point is that, yeah, of course, we have a huge task, and hepatitis elimination is a must because it's a huge public health burden. But at the same time, sometimes deadliest may not be the correct word, because negative awareness is also generate fear. I mean, fear generation also can create negative awareness, and at the same time, it's not perhaps the deadliest. We have very good medicine of hepatitis C, viral hepatitis A, B. B is very much manageable disease. A is not a huge problem unless if you have proper, education, if you have proper access to treatment. So I'm just asking whether we can use deadliest or it's a deadly virus or something like that.
Of course. And of course, we do have to, we always want to make sure that I think the three tests that we have for any communications campaign is the information accurate, to make sure it's not misleading, and to make sure it's not harmful to every group. Now, in terms of infectious disease, in the last data that's available, that's in the Global Hepatitis Report, the most deaths from infectious disease was COVID-19 in 2022, but it was only slightly above hepatitis, and TB was about equal. So in terms of global deaths from an infectious disease, it is the second most deadly disease. So that was the justification or the reason why we use this language. And I think because this is aimed at getting people's attention and to really communicate the urgency of the situation that we're in, is why we did choose to use stronger language in this case. And it does, I think it really does get the message across. Of course, in communications, things can be interpreted differently, and we try to minimize that as much as possible. But that was really the rationale and the justification behind that particular wording. But of course, if you feel that it could be misinterpreted in your setting or in your country, we're trying to write messages for the whole world here. You can choose not to use it, or you can use the poster tool to make it more appropriate for your own setting, which is always a challenge to try to do that. But thank you very much for your feedback.
Thank you.
Diana, could we open Diana and Manal's microphones, please? And I think we can close the other mics as well. Diana, would you like to go first, please?
Hi, I wanted to find out if the theme is in consensus with WHO, because my group in Ghana, we usually see different campaigns being run from World Hepatitis Alliance and WHO, and we don't know whether we are in consensus or is separate.
So I don't know if anyone from WHO is on the call. If you are, please feel free to raise your hand and to speak to this directly. I mean, we always work very closely with WHO around the messaging around World Hepatitis Day. And we think they are going to be aligning their materials and their messaging. And a lot of when you go look at the resources, at the text-based, fact-based posters and social media ones, those are all aligned to the WHO report, but they will have some of their own creatives. So it may look slightly different, but I think they will be using It's Time for Action, and they will be using a lot of the same images. So there will definitely be a link, but it may not look exactly the same. But I think they're still going through their internal processes, and they could very well use some of the design aspects of ours as well. But it may not be exactly the same, but it will definitely be aligned. I hope that answers your question.
Yes, thank you.
Thank you. Manal, nice to see you.
You too. Thank you. I just wanted to add a comment. It's not a question per se, just to add my comment to the question Tony Garba asked. If we were to start later or now, I just wanted to add my own experience, talk about my own experience in doing things and using the resources of WHA. So it all depends to what you choose to do as a country or as an individual organization. So whether to start now or later, I usually start, for example, a month ahead before, as a form of a campaign. So because there are so many posters, so many resources that you can use within a long period of time to disseminate impactful messages within a longer period of time, rather than overwhelming the audience you are trying to reach within a short period of time, just like in July or when the days are approaching for World Hepatitis Day. That's just my take. Thank you.
Thank you, Manal. That's really great advice. I just noticed another question in the chat about what's there for healthcare providers. So some of the posters, when you go on the website, some of the text-based posters with the longer messaging, we specifically made for places like waiting rooms or places where people may be waiting to see their doctor, their healthcare provider. And it does, the call to action is to ask and find out more about hepatitis vaccination and testing. So I think when you look through the resources, hopefully you'll find lots of things that you can use within your own healthcare settings to put on the wall to raise awareness, to prompt people to find out more about hepatitis. And of course you're free. I mean, some clinics, they have sometimes they have screens showing different information. You can, feel free to use the film, which is absolutely understandable without any audio. It can be played on video screens within waiting rooms and in different healthcare settings. But if there's something you would specifically like for your setting that we could help with to make a small adaptation to one of the resources, you can always reach out to us, and we'll be happy to help if we can. Okay. So if no one else has any questions, I know, Richard, your hand is still up. Do you want to try one last time? Otherwise, type it in the Q&A. Okay. Richard, if you do have a question, type it in the Q&A and we'll do our best to answer. Okay. So now we're just going to move on to, and just someone's typed something in about liver cancer and other things. There are actually some messaging in the wider set that we haven't showed here around hepatitis being the most common cause of liver cancer. So there are resources there that talk about that already in the hard-coded ones. But again, you're very welcome to use the poster tool to create your own messages and use those in your own settings. So maybe we'll just move on to the next section because we have more things to tell you about. So Steve, I can go to the next slide. And the next slide again. Is Toby, are you talking about this or Steve? Whoever, take it away.
I'm going to take it away. I'm going to talk about the pledge tool. So I will stop sharing the presentation again and just show you on the website. So on the website, you'll see that there is a section in the menu called Pledge. When you click on Pledge, it urges people to take action and pledge to help eliminate hepatitis. This is a really useful a tool that we use each year to drive engagement on the topic. It's very simple. We ask people to submit an email address and their name, and this will sign them up to a newsletter to receive more information about hepatitis, the work that we and our members are doing, World Hepatitis Day, and so on. And then once people make a pledge, clicking this button, go through an animation. Thank you for taking action. What you find here is an animated GIF for people to use across social media. Below this, we have buttons that allow people to share that directly through their accounts, and it provides them with some copy as well. So you get that consistent message across social media, though people can add to it or change it as they prefer. But these kinds of animated GIFs, these kinds of pledge statements have been very helpful to drive engagement across social media platforms in the run-up to and on World Hepatitis Day itself. We also have our social media relay that we do each year, which I will now hand over to Toby to discuss. So I go back to the slideshow.
Oh, okay. Thank you, Steve. Just in addition to what Steve has said, we have the Global Virtual Relay, which is an opportunity for you to let us know what you're doing on World Hepatitis Day. So what you're going to do is to take a 30-second video of yourself or about what you yourself or your organization is doing towards hepatitis elimination on 28 July or even around World Hepatitis Day itself. And then you can send this video to us on our contact inbox at contact@worldhepatitisalliance.org. We're going to add that to the chat box just so you can send that to us. And yeah, just it's really simple. Take a video of yourself, let us know what you're doing, what action you're taking for World Hepatitis Day, and then if you can also post it on your own page, you can use the hashtag WHD really. However, for us, we're going to be posting this on World Hepatitis Day itself, and that's on the 28th July. We're going to post it on midday and put in a relay of everybody's videos, everyone that sends us a video from different regions. And we're going to be posting that on Twitter, on Facebook, on Instagram, and just to create awareness about hepatitis on World Hepatitis Day. So please feel free to share this with us on our contacts inbox. I think Steve will take you through other ways you can get involved.
That's correct. Yes. Thanks, Toby. And of course, if there are any other actions that suit your organization, your region, the kinds of communities that you work with, the longer actions that people have taken in the past, obviously creating posters, we've created tools specifically for that, but events, very welcome, hosting webinars, arranging advertising like billboards, outside spaces. There's a brilliant tradition now of lighting up certain monuments that definitely in Niagara and in Australia is still going. That's fantastic. We also have a template letter under our Take Action section of the website, which I can show you. bring that up. So if you go to take action, then just scroll to contact your policymaker today. You'll find that there's a letter template. You can just scroll down through the page, which has good information on advocacy actions you can take and how to engage with policymakers, how to use stories from the community. But you'll find at the bottom of the page this letter template for this year's World Hepatitis Day. And there is also a Word document version of it as well, which is on WHA letterhead paper. So if you have access to Microsoft Word, then that could give it a particular look and feel, could be extremely helpful. So yeah, some of these longer actions would be really welcome if you wanted to follow through with them, and obviously just tell us about them, because we can promote the work that you are doing through our social media channels and get an even larger reach. I'll just pass back to Carrie now to let you know about a couple of our upcoming webinars.
Sorry, so I'm just typing answers in the Q&A. So
No
as always,
problem.
we'll be having working series of webinars before World Hepatitis Day. So on the 24th of July, we'll be hosting Turning the Tide webinar, which is really, again, referencing back to the Global Hepatitis Report and showing that in many ways that we're going in the wrong direction in hepatitis elimination. So what can we do to turn the tide? How can we do things differently? Who around the world are really, being innovative and trying new things to reach our goals? So we'll look at different aspects from testing to treatment to birth dose vaccine, have some inspirational stories, and we'll also be making some announcements about new initiatives that WHA will be doing to help turn the tide globally for hepatitis elimination. And then on the 26th of July, we'll be holding our community forum, which we have been holding for the last 2 years, has been very popular, really providing a space for people living with viral hepatitis to share their stories, to support each other, and just to talk about why World Hepatitis Day is so important to them and why hepatitis elimination is so essential. And just to give a plug for WHO, each year does a global hepatitis webinar. Because World Hepatitis Day is on Sunday, they're planning on doing it on the Monday, the 29th of July. So just keep an eye out for that. Next slide, please. So we can just pause one more time to see if there's any questions about any of the advocacy actions or any of the things we just talked about. Please raise your hand or I'm trying to answer the questions in the chat. I think I've done most of them. Any questions about those other actions or anything else? We'll be sending everything out via our normal mailing lists, and we'll have different updates, and there'll be a communications toolkit with some social media suggestions and some suggested posts that we'll also send out closer to the time. So keep an eye out for those. So we've got a couple of hands up. If you could just open their mics, please, Steve.
I've opened up Iranam's mic.
Iranam, please speak. Please
greetings,
go on.
everyone. Greetings, everyone.
Hello.
It's a privilege for me. Can you hear me, please?
We can hear you. Please go ahead.
Okay, good day. Greetings, everyone. Well, I'm speaking from Nigeria. The founder of a hepatitis support group, and we have majorly been conducting awareness campaign. We have been conducting free screening for a period of over 2 years now, and we are officially a member of the WHA. So out there in the field, we can afford the test kit just like we've been doing. Awareness Month, which we had 6 major outreaches around our various communities targeted at the youth population. And then we had over 950 persons on screen with very alarming results that came out. However, our major concern is vaccine. Just like this World Hepatitis Day is coming up to the end of next month, we're already making provision for the testing. However, vaccines are not available. So we wish to know if there will be provisions for this year or in subsequent World Hepatitis Day for allied members of the WHO, so that these vaccines could be made available for the uninfected population to be vaccinated. Because back home here in Nigeria, in Cross River, where we measure, people are willing to receive the vaccines, but unfortunately, these vaccines are not available. So our works are online. Most of our works are online. So that's a question. Will there be provision for vaccine? If there will be no provision for this year's program, in subsequent World Hepatitis Day outreaches or programs, we will advise or recommend and then appeal that vaccines should be made available, please. So thank you.
Thank you so much for your comment. We appreciate that so many of you are facing huge challenges around access to to vaccines, like you mentioned, or testing or anything else. I mean, we hope that the letter that we provided here, which is co-signed by the World Hepatitis Alliance, can help you reach out to the leaders and the healthcare leaders in your area to really urge them to provide these very basic services. So we hope that will help, and we hope that the campaign itself will help influence. I know in Nigeria, it's down to the state government. So if we can, if there's anything further we can do around the letter or providing a tailored letter that you can send to your, local health officials, we'd be very happy to help. But yeah, we really appreciate that a lot of you are in very difficult circumstances around resources and provision of really basic hepatitis elimination services. So thank you. Abdo, would you like to unmute your microphone?
Hello, everybody. Apologize for joining late, but I'm from Sudan. We are celebrating the World Hepatitis Day since 2017 with the Federal Minister of Health. We are clinicians, but we are focusing on hepatitis elimination program. We are part of the strategy plan, which adopted or done by the Federal Minister of Health and focal person for hepatitis. But we are the main task force in this as clinicians, because we are seeing the complication of the disease. And despite of the war, our colleague, Dr. Hala, managed to celebrate the last year in Atbara city. And this was appreciated by many hepatitis task force. And this year we are planning to celebrate this Hepatitis Day in Kassala city in east part of Sudan, despite of war. And we are working, we have a plan for hepatitis elimination. And really, we need support, because the drugs are not there now. The vaccine is not there in the country. We are working together with a focal person, and they meet the WHO people in the WHO meeting now. And the first dose of pairs will be accepted as as application to Gavi this year, and this is good news for us. I really want people, if I put my email, if anyone want to join as a guest speaker in our event, can send me email, and I will invite and arrange the joining our celebration. Thank you very much, really.
Thank you so much. And of course, if there's anything that we can do to support, like provide a speaker for your webinar, or again, help with any kind of letters you would like to send or messages you'd like to send to your local leaders, please do let us know. And you bring up a very good point in that yesterday, Gavi opened the request for proposals for birth dose vaccine in Gavi supported countries. So from yesterday, countries can apply for grants to provide the vaccine, to do the initial setup and implementation. So that's another big advocacy point for civil society that we need to make sure, and something that we're working on at World Hepatitis Alliance on a global stage, to make sure that the countries know about it and to do everything that we can to encourage countries to apply either in this window, or there'll be a second window slightly later in the year. And then next year, there'll also be opportunities. So if you live in a Gavi supported country, if you know that, and you do not currently have birth dose vaccine, your country could be eligible to apply for funding from Gavi for the birth dose vaccine. But we will send out more information about that as we go on. And I'll just put the link to the page on the Gavi website in the chat. So everyone, actually I can't because I'm not a panelist, I'm not a host, but Steve or Toby, could you put it in the chat, please? And then so you can all have a look for yourself. But part of Gavi programs does include a recommendation or a guideline to include civil society within those vaccination programs. So it's really important that we are engaged with this on a country level as well, and that yeah, we're really working to make this happen. Prince, I see your hand. Steve, could you just open his mic, please?
So thank you very much. Okay, can you hear me, please?
Yep, we can hear you.
Oh, thank you very much. And let me start by appreciating the WHA for this very important webinar coming up that is currently going on. And I would just like to touch on the treatment access. As I will always say that as much as we are talking about eliminating viral hepatitis, looking at the target for 2030, I always say it doesn't presuppose that we should eliminate the people living with viral hepatitis, which it seems to be what is currently, subtly going on. Because why I say this is because while we try to reduce new incidences, I think national governments have not really paid much attention to people who are living with viral hepatitis B and C and D, of course, in terms of treatment access. I'll use Nigeria as an instance. And one of the challenges we are currently seeing in the country is access to the global access price for these commodities, which has posed a very significant problem, in the country. And so I think while we are preparing for the World Hepatitis Day, we should also be looking at messaging, targeting at creating this awareness around these global access prices. And also maybe the WHO can also be looking at closer interactions with national and subnational governments, with partnership or in partnership with local organizations. Okay, I think that can, go a long way, because from my interactions with some of these people who are in government, they seem not to be aware of what is happening at the global stage, like this pricing access. And so I think there needs to be more messaging around this kind of interventions from the WHO. Thank you very much.
Thanks, Prince. And of course, access is so important. And it is quite, shocking, really, that countries, even neighboring countries, pay really hugely different prices for hepatitis B, especially commodities, hepatitis B treatment. And this is something that we've been discussing with WHO as well. And I believe that they're going to be doing some additional reports on access pricing and how countries can access those prices and doing some specific outreach to countries who are obviously overpaying for things like hepatitis B treatment to try to help them access the best prices available. And again, the reason why we make these campaigns so broad in terms of it's time for action is so you can do exactly that. You can use that messaging to really talk about access in your areas and to really bring that message forward. I do know that access will also be part of, I don't know this, but we believe that access will also be a major part of WHO's messaging this year. And in terms of WHA engaging more or supporting our members with, with their own local governments, I mean, if you have a ask for us, if there's something that we can do, I really encourage you to kind of reach out. Obviously, as a global organization, it's hard for us to be involved in every country or every province. But if there's a specific need or there's something that you think that we could do to help move the needle in your area, we will 100% do everything we can to support you. Thank you. I think we've got one more hand. We got another hand up. Mikey.
Hi, Carrie. Thank you very much. And thanks to the entire WHA team for this amazing initiative. This is Gilbert Mickey, Community Vision Group, Cameroon and Malawi. I just wanted to chip in with my colleagues from Nigeria raising the concern. I think on a very special day like this, or even a week running up to the campaign date itself, what makes World Hepatitis Day so meaningful in the respective countries is the sort of activities that are being carried out, like screening, kind of engaging in testing, and then vaccination campaigns and so on. I would have just been putting it to World Hepatitis Alliance to maybe make due consideration, if not for this, but for future events, to say, let's have WHA members supported towards the screening and the vaccination campaigns, because these are very important. And sometimes people get less motivated when they even just come around to you tell them about hepatitis, what next? It's very important to accompany the talking with some bits of action that can be helping to move the needle towards the elimination campaign. So it's not really, it's just a request that is coming across for due consideration for World Hepatitis Alliance members. Thank you.
Thank you very much. And we really appreciate how much all of you do with such little resource and oftentimes. And it's also difficult for us globally. And we do try to look at new ways that we can find funding, that we can get resources to members. But of course, we're also constricted by the funding that we can get in order to pass on. But we do continually ask, and we are trying. I think many of you are already involved in the consultation around a new initiative that we're hoping to, we are planning on bringing later in the year, which will be World Hepatitis Testing Week. So it'll be another opportunity for us to focus on hepatitis testing at a different point in the year. And as part of that, we're in active conversations with some providers, some diagnostic companies about whether we can set up some kind of initiative where people can, apply for some support with diagnostics. But of course, it won't be everywhere and it won't be enough for everyone. But just know that we do try to bring as much value as we can down to all of you, our members, which is why we started the Community Impact Program to help, with kind of skills and knowledge and other things. But we do realize the really challenging situation you all are in, and we hope that we do try to help with as much as we can in terms of resources and things. But unfortunately, small grants aren't something that we can help with this year. Okay, so it looks like we're at the top of the hour. So it's just we've got one more slide just with the timeline. So, so as you can see, we're going to release the toolkit on the 1st of July. So maybe we'll pull that forward just maybe a tiny bit to have it be 1 month out, since that seems like what people were saying. And we'll put our first posting with the new identity out on 1 month to go. We'll be releasing the hero film on the 14th, as we said. And then 24th of July, Turning the Tide webinar, 26th of July, community forum, and of course, the World Hepatitis Day global relay on World Hepatitis Day itself. We're asking people to submit their videos by the 14th of July. So if you have any, we'll send out more information about that, or if you have any questions, you can see the contact email is there. Just send us an email. And yeah, we'll do our best to get back to you as quickly as possible. So it just goes to say thank you all very much for attending. If there's any questions that we missed in the chat or anything, again, just send us an email. Thanks to Toby and Steve for presenting and all our fabulous interpreters. And we look forward to working with you all to have another impactful World Hepatitis Day this year. So thank you all very much, and I'll see you all soon. Thank you.